Although the medical workers preferred to remain anonymous, Uganda Medical Association Secretary General Dr. Herbert Luswata told NTV that they were left with no option but to strike.
They have been working for, I think, more than a month now, and they have never been paid any risk allowance at Kaweri.
They are responsible for handling Ebola patients in Kaweri Treatment Unit attached to Mubende Health Center 4. Dr. Luswata says the ministry had referred them to the NGO Medicine Sans Frontier, which reportedly denied any responsibility for their employment.
So they remained confused. They were wondering if they are going to continue working without paying, because none of these concerned people was willing to give them their risk allowance. So today morning they had a meeting and they decided that if they don't get clear information on who is supposed to pay them and actually also receive some payment, today evening they will not report for duty and they will also not be there tomorrow.
Health Minister Jane Ruth Acheng has appealed for patience as the ministry handles the matter.
Because we had to open another ETU as an emergency because the number of cases at that time was big. So they were trained quickly and deployed. But since then, their contracts have been written, they will be receiving their contracts and they will be receiving their pay. Let me stress here very clearly that there is no amount of money that can pay a health worker who sacrifices to go into an ETU. ETU is Ebola Treatment Unit to give services to sick people. No amount of money.
Ministry of Health has for long been handling medical workers' strikes over contractual issues.
So this is where the problem is coming from. People are working, but they don't have signed contracts, and this is something I've been pushing for a long time as Uganda Medical Association, that everyone who's working in Ebola Treatment Unit should have contracts which are duly signed with clear terms and conditions of work.
What I am learning from health workers in Uganda is that there is a lot of impatience. People don't want to be patient to follow procedures. Everybody thinks that striking is the way to go. But striking does not save lives. Striking does not give back a dead person. It is important to exercise restraint and be patient and understand that systems of government must be followed. I have not seen a situation where government has failed to pay anyone. Government may delay, but government will always pay.
Mubende and Kasanda districts have been under lockdown for a month to prevent the spread of Ebola, and any success so far achieved might be derailed if the frontline health workers go on strike. Edward Muhumza, NTV.